Welcome to the e-learning module for occupational health, environment and safety. Today let us learn about drowning and the first aid we can provide to its victims. Let's take a look at the key learning objectives of this lesson. After completing this lesson, you will be able to explain what is drowning and near drowning, list people who are prone to drowning, list the causes of drowning, and demonstrate the basic first aid to be provided to victims of drowning. Let us now understand the meaning of drowning and near drowning before moving ahead. Click on each image to know more. Drowning is the process of experiencing respiratory impairment or damage from submersion or immersion in liquid, normally water, usually resulting in death. Drowning is a very common cause of accidental death. Near drowning occurs when the drowning victim survives after a drowning event. Near drowning can even lead to neurological damage. Drowning is of two types. They are wet drowning and dry drowning. Wet drowning. In wet drowning, the person has inhaled water which affects respiration and causes the circulatory system to collapse. Dry drowning. The airway is choked by the spasms caused by the presence of water. Let us understand who all are most prone to drowning. Click on each image to know more. Children. Children under the age of 5 years have the highest drowning mortality rates worldwide. The risk factor increases due to lapse of adult supervision. Males. Males are more likely to drown than females because of their risky behavior and alcoholism. Fishermen. They're always in water, which increases their chances of getting drowned. Ferry commuters. People commuting by boats and ferries to cross the river are at risk due to overloading the vessel or boats, lack of life jackets, etc. Others. Adults with epilepsy, adolescents staying in and around open water bodies, tourists unaware of the local water risks and features are also highly prone to drowning. Large sea waves, overcrowded swimming areas, turbid water, etc. also contribute to drowning incidents. Some of the causes of drowning are as follows. Click on each image to know more. Infants less than 1 year can drown in bathtubs. Small children may drown in swimming pools if left unattended. Young adults may drown in rivers, lakes, or sea due to injury caused while diving. Adults drown when under the influence of alcohol. Medical emergencies while swimming, like seizures, heart attack, injury, hypoglycemia, etc., result in drowning. Natural calamities like flood, tsunami, typhoon, etc. can cause drowning of many people. Boating and water sports accidents during river rafting, surfing, etc. result in drowning as well. Suicidal attempts. Let us now learn about the basic first aid that we can provide to a drowning person before taking him or her to the nearest hospital. Click on each image to know more. Rescue the drowning person with a safety tube or a life jacket and do not put yourself at risk while saving others' life. Check if the person is breathing. If not, clear his or her airway. If breathing is not detected, check for pulse at the wrist or the neck area as indicated in the image. Start cardiopulmonary resuscitation, CPR, immediately if pulse or breathing does not start automatically. Do 30 chest compressions at a rate of 100 per minute. Provide basic first aid if the person has any cut or wound before rushing him or her to the hospital. Now let's recapitulate some of the points that we should remember to avoid drowning or near drowning situations. Refrain from swimming beyond your skill level or in restricted places. Do not use alcohol or drugs when swimming or boating. Provide adult supervision for children around water bodies. Build barriers around swimming pools, fences, gates, alarms to prevent children from entering unattended. Create and maintain safe water zones for recreation. Provide easy access to life jackets on ships and boats.
Drowning victim rescue. Once you have entered the water, approach the victim from behind using the modified front crawl or modified breaststroke. Secure the victim by placing your arms in a hooking motion under the victim's armpits. Position the victim on the rescue tube by slightly leaning their upper body onto the tube for flotation. Make sure to secure the victim by grasping onto their shoulders. Using strong circular kicking motions, move the victim to safety. It may take a second to gain momentum before you start moving with the victim. If the victim is able to kick, they may assist you in reaching the edge or shallow area. If the victim is conscious, make sure to communicate to them that you are the lifeguard and you're there to help. As you reach the edge, do a spinning rotation so that the secondary lifeguard may assist in assessing the victim's condition. Unresponsive victim rescue. Approach of an unresponsive victim has many of the same steps and maneuvers as the drowning victim, but in this case we have to make sure to better secure the victim's head and neck. Unlike the drowning victim, unresponsive victims will possess no muscular strength or control in their neck, and therefore will not pull their head out of the water. In securing an unresponsive victim, approach from the side and slightly lean the victim's head backwards to one side so that it may rest on the opposite side of the lifeguard. Repeat the spinning rotation once you reach the edge so that the secondary lifeguard may secure the victim by grasping their wrists, guard's right hand to victim's right wrist, and left hand to left wrist. Removal. Once the unresponsive victim has been secured at the edge of the pool, the lifeguard team must execute the removal phase. 2 lifeguards are required for this rescue. First, the primary lifeguard will exit the pool to retrieve the strapless backboard once the victim has been secured at the edge. Next, the primary lifeguard will bring the backboard to the water's edge. The secondary lifeguard will indicate whether the board should be placed to the left side or right side of the victim. If the secondary lifeguard's left hand is on top, the board is placed to the left. If the right hand is on top, the board goes to the right. Once the secondary lifeguard has indicated which side, the primary lifeguard will ease the board into the water, feet end or narrow end first, making sure to put the board in straight up and down so that it does not float or shift. The board should be placed so that the victim's head matches up with the top of the board. Next, the secondary lifeguard will rotate the victim by uncrossing their arms so that the victim is positioned on the board. The lifeguard on the left side of the board will grab the left arm and left side holder, and the lifeguard on the right will grab the right arm and the right side holder. Once both lifeguards have indicated that they have secured the victim, slowly ease them out about a foot to make sure they are securely on the board. Once the victim's body drops on the board, slowly remove them from the water. Initial assessment. Once an unresponsive victim has been removed from the water, an initial assessment of their condition must be conducted. Lifeguards must check the airway, breathing, and circulation of the victim, giving specific care such as rescue breathing or CPR as needed. Remember to always use protective barriers such as latex gloves and breathing barriers. Escapes. If a lifeguard finds him or herself in a situation where a victim has grabbed onto them for flotation, it is important to stay calm. If possible, give the victim the rescue tube and tow them to the nearest edge or shallow area. If it's not possible to simply give them the rescue tube and they are actively latched on, follow these escape steps. Step 1. Take a deep breath and submerge underwater. Often, once air is taken out of the equation, the victim will quickly let go and return to the surface. If this does not occur, grab closest to the victim's elbows as possible and try and force them up and over your head. Step 2. Swim a safe distance from the victim. Regain your rescue tube and reassess the situation. If it is possible to simply use a tube extension, do so and tow the victim to the edge. If this is not possible, retry the rescue, always coming from behind the victim and reassuring them verbally when possible. If the victim has latched on to another patron, multiple lifeguards should be used for the rescue. Simply secure the larger of the two victims and with assistance tow them to safety.